So I would just like to remind everybody not to underestimate the human element of auditing, because again, knowledge is becoming more and more accessible to everybody. And so people will not put up with a poor communication style or a poor presentation style just because you have a lot of knowledge. For that, we have a couple of auditing principles: integrity, fair representation, due professional care, confidentiality, independence, and evidence-based approach. I think most of or all of you should know all of these. And so I'm not even going to walk you through that. I think for an external audience, maybe that would be more important. But if you don't know any of these, maybe, you can reach out to me now. Or if you think that, you don't want to expose yourself, then you can reach out to me after. But I would definitely expect everybody to know this. Okay, it's not a problem if you don't know it today, but then we will need to go through this, because sometimes some of these principles are also reflected in the opening and closing meeting checklist, and we need to mention this to the client of what is our interpretation and what is the practical impact of these principles of how the audit is going to go. Okay. As the auditing, especially third-party auditing, is always under time constraints, I would say the good auditor knows where to cut corners and still get their work done. What I see is that novice auditors or auditors who don't care that much, they don't know where to cut corners, or they just don't care. They just fill up the auditing time somehow. But I think it's more value added for the clients if we know what is essential to the product, what is essential to their processes on a risk basis, and ask more questions about the more essential processes and parts of the product. And if we find smaller deviations on the non-essential side, maybe we don't spend too much time. Maybe we don't even raise a non-conformity if that means that we can spend more time on the things that are really value added to the product. Okay, so I think it's always a balancing act, and as you are becoming more of an experienced auditor, you will need to find what are the aspects that you need to go deeper down. So I'm going to talk about that a little bit more in these slides. I would also say that the purpose of auditing, and this is always my analogy, we are the bees who are collecting the pollens. We are not the bees who are building the beehive, and we are not the bees who are making or turning the pollens into honey, at least not during the audits. Okay, so what do these analogies mean? That we are there to observe the system, not interfere with it. We as auditors, especially third-party auditors, we rarely have the full information about the manufacturer to even be in the position to advise them of how they should run their business. Okay, so my number one tip is, like, don't interfere with how the client is running their business and their processes. Just observe, compare with what you see versus the audit criteria, and document that comparison. That's all we do. What we do is diagnostics. We don't do therapeutics. Okay, what we just take away the information, and whoever paid us to present this information, we will present it to them. We don't need to tell the line worker or the design engineer or whoever else at the company how to do their job. Probably they know their job better than we know. So it's we shouldn't assume that we know better, even if we know some practices from the industry that we would consider best practice. Maybe that's not the most optimal solution for this client, or I would also say that sometimes it's really just suboptimal compared to how they want to run their business. And another thing is that if we have seen industry best practice at another manufacturer, that technology or that process or method might be proprietary. So by gloating that you know much better how to do this, you might expose someone's protected information or confidential information to another client. And of course, that severely undermines the credibility and the trust in our services. Okay, so please consider your role to be confined to just taking the information. Of course, when it comes to findings, you can explain, in more details what was the audit criteria and why you consider that to be non-conforming. But you should never word it in a way that you tell the client what they should do or shouldn't do. Okay, I'm going to talk more about findings a little bit later, but generally this would be one of those things. Also, maybe just to take a step back and some of the basic principles of how or why a quality management system is so important for medical device manufacturers. So basically, putting safe and effective medical devices on the market, generally speaking, take two theoretical steps. One is that you create a safe medical device, which we call like a prototype, and make sure that that prototype meets the requirements, external and internal requirements, including customer requirements, regulatory requirements, all other things. But of course, we cannot examine all of the devices to the same depth. And so for that, the second step is that we need to make sure that the quality is consistent in routine production and service provision. So we don't need to go as deep as a type testing during routine operation. In some cases, the test that we do in the type testing is destructive and not reproducible. So for example, if you would do some sterility test, you would need to open up all the blister packages for a whole batch, and then you wouldn't be able to release anything. So for that reason, we have to have some sort of a sampling based or some sort of a system that ensures consistency in the routine manufactured units. Okay, so this is just, I think, important to clarify and to state. And also another consideration is that during the design and development and the ideation of the device, how I think about it is that the safety and effective goes up. So we are adding more and more safety features. We are designing it to be more and more effective. And then we transfer it into manufacturing. We don't add more safety to it. We don't add more efficiency to it. What we need to make sure is that we don't decrease the quality of the product, safety and effectiveness of the product to under what is acceptable during the manufacturing process. So basically, we build up the quality in the design phase, and then we try to preserve it during the manufacturing phase, and not just manufacturing, but also the subsequent, transportation, installation, servicing. Should preserve the quality of the product at mint and pristine condition as possible, because every processing is an inherent risk itself and is a source of risk. It's a source of hazard in itself. You can damage the product even during an inspection process step, or you can damage the product wherever. So that's why manufacturers also have to be really careful about being the least invasive to the product during the manufacturing process. Okay, so that's maybe some of the basics. I would also say that for an audit, and I'm going to talk about it a couple of times, we don't have to be perfect. Okay, our audits can only be so good as the audit criteria. Okay. We don't have to force the client to be better. If they are meeting the requirements, that's good enough. And I want to really state this, because this is what I mean here, is that sometimes the standards are not very demanding that we are auditing to. And then we have to have the flexibility to work with those limitations. And just because some clients exceed those limitations, we don't need to force this audited client to meet those higher standards as well. If they meet the bare minimum of the standard, we will pass them, and we don't write non-conformities. Okay, I just want this also to be very clear, that it is not considered to be a poor auditing job. It is considered to be an optimal auditing job if a client who's barely passing still passes. Okay, I just want to make it very clear. You don't need to get someone from zero to hero in one audit. They will build themselves up based on our feedbacks and findings over the years. But if they are just meeting the requirements every year that is applicable in that given year, then that should be good enough. Okay. Another thing that I often see is that some people, this middle picture shows to represent that not every song needs a solo, right? Not every audit needs to be your magnum opus. It is fine to just get through the audit with an acceptable quality and move on to the next project. Okay, so if you polish your audit, if you polish your notes, then that takes time away from your next project, whether you need to, plan the next project or answer queries or submit other packs or whatever you're doing. So don't over polish your projects, don't overdo it. The regulatory minimums have been set in place in crucial points where it matters, and make sure that you don't exceed those minimums when you don't have to. And with that, you are going to release or free up resources so that you can put in other places where it really matters. Okay, so I think that is also a really, really important part, that you shouldn't go the extra mile. I would say you go the extra mile by not punishing the client of being late with your reports and stuff like that. So that's what I mean, is that try to do the acceptable level and don't necessarily go too much. And the third picture is that the auditor, sometimes, of course, we see cool technologies and cool processes and cool, maybe new, I don't know, a new EQMS solution that you have never seen before, and you're interested in learning more about that. It is fine to learn more about it for your private, how should I say, enlightenment or education, but it should never distort the audit. You should never spend half of the audit just auditing all aspects, or just learning all aspects of a product or a technology or a new software system because it is personally interesting for you. We are there to do a job, and so if you learn a little bit more about it, maybe you can, go out with the client later or have a working lunch or something like that and discuss about it when it's outside of the auditing time. But during the audit, make sure that your personal interest and affinity does not distort the audit program, okay, or the audit plan. So these are maybe some of the practical considerations of how not to overdo an audit. Some of the stuff that auditors sometimes forget is that some of the audit criteria that is, I think now it is part of the audit plan template, but for second-party audits and also what the clients are doing, for example, their supplier audits, we have to recognize that the contractual obligations are part of the audit criteria. I'll give you an example. If the client is outsourcing the heat treatment of a metal implant, the client has an obligation of keeping their records, manufacturing records for 15 years because it's an implant. If they outsource the heat treatment and the supplier doesn't keep the records or throws the records away after 1 year, then the legal manufacturer is going to get into trouble. The legal manufacturer will need to put it in the software quality, or not software, sorry, the supplier quality agreement, all aspects of the outsource process, including basic things like record retention. Okay, and the supplier will not have any other, like the standard will not tell them what is the record retention. They have to look up the quality agreement, and you also cannot just say that, or you or the manufacturer, when they are auditing their suppliers, cannot just say that, oh, I'm just auditing to the standard, because the standard doesn't cover everything. In some cases, the details, the quality details and the regulatory details are in contractual agreements. Okay, so make sure that you take the contract that is binding the operation of the audited client as part of the audit criteria. It may contain wonky things. Maybe you would do it differently. Maybe the distribution of responsibilities you would absolutely do differently, but it doesn't mean that how they do it is not acceptable. Okay, so just keep an open mind about it. But if something is definitely not regulated, then that can result in a non-conformity or a finding. Okay, the other part is the auditor's own QMS documentation. And the impact of that is that they themselves can self-impose higher requirement than what are the external requirements. And you have to hold them to their own procedures. So, for example, maybe let me just give you an example. For a Class 2B product in Europe, the client is expected to update certain clinical documentation not later than every year. Maybe they will choose internally that they want to update it every half a year because it's such a cutting-edge product and so many new clinical data comes out that they want to do this every half a year. And they prescribe it in their own procedure. You will hold them accountable for that procedure. And even though maybe the external requirement is just once every year, but if they self-impose a stricter requirement, then you will enforce that. And you can absolutely write a non-conformity against their own procedure, even if it does not violate an external regulatory requirement. Okay, so I just want this to also be clear. And I would also say that we don't need to second guess why they have put a more strict requirement in place, because in many cases, that's how they compensate for some other shortcoming or weakness in their system. So don't just say that, because the regulation only requires it once a year and you do it, you prescribe it for yourself every half a year, but you haven't done it for 10 months. Then that's okay, because you're still in alignment with the external regulation. Maybe internally that in-between review is missing from somewhere where they needed it to compensate for some other shortcoming in the system. Okay, so please make sure that you absolutely treat it as a driving document, the manufacturer's own QMS. Maybe they will realize their own stupidity if they really had no good reason to put more strict requirements, but your feedback will anyway provide that input for them to review their own system, okay? And by the way, you guys can stop me at any point in time if you have any questions or comments to any of these slides. Some of the other basics is combined audits, regulatory combined audits. And I also just want to point out that how we always think about these regulatory combined audits is at the bottom of it, or at the heart of it, it's always an ISO 13485 audit. And we kind of dress up the individual requirements as they are augmented by the different country-specific requirements. And this also applies to MDSAP, but we can also treat the EU or any other jurisdiction that we are auditing to, like the UK, for example, as a country, and just consider their requirements to be country-specific requirements. It is even, I would say, almost plug and play into the MDSAP audit approach as well. And in those cases, of course, we are wearing multiple hats, because we have to make sure that at the end of the day, the client's QMS has to comply with each set of regulatory requirements individual. Because when these reports will be sent to the regulators, they will not be terribly impressed or moved by the fact that the client is in compliance with some other jurisdiction. If you have in your audits have not covered the Brazilian requirements and the client sells products there, then they will not be happy if you tell them that, but they had a lot of problem in the US, so I focused on that one. The Brazilian authorities will still not have enough information, so your report will not be usable for their regulatory purposes. Okay, so make sure that you treat it in a way that each requirement is represented in your report, okay, to at least an acceptable quality or amount or representation. This is a slide that I've already put on one of our previous monthly calibrations, but this harkens back to the soft skill discussion that I mentioned. You have to find an optimum balance, and this I can honestly say that based on my auditing experience, it only comes with experience and just doing it for years. You have to find your own flavor to know what are the things that you have to go deeper and what are the things that you can and should let go. Okay, so I would say that the left side here is I would say the extreme end, where you get hung up on all the little nuanced topics and you cannot let it go. And you just enjoy arguing with the client for hours and hours on minuscule things. This is also not good. The other end of the spectrum is when you're just a scribe, and without critically thinking, you are just literally writing down everything that the client says and don't put your own evaluation. You just refrain from writing findings, and you just say that this is what the client said, and that's it. That's not auditing. Auditing is basically a critical evaluation of the client's QMS and products. against the audit criteria. Okay, so the good solution, I think, is kind of in the middle. When you have a healthy skepticism, they can, prove themselves to be knowledgeable and do the right thing, but the client has to prove themselves during every audit. You cannot say that, oh, they are historically very good, so I'm going to give them a pass. The client and you have to prove yourself during every audit that you guys still know what you're talking about. Okay, and they might be very good at certain things, but they might be gaslighting you in other things. I remember there was a multinational company, a very big company. Probably you guys would know it. I'm not going to say the name, but it was a very, very big company that I have audited for years. And they always said that, like, when it came to process validation, for example, they didn't really do all the process validation. They did kind of like an in-house flavor of it, which was kind of a light version. Especially in the OQ phase, they didn't go super deep into exploring the critical process parameter windows. For years, they were defending that, yes, it was acceptable by all the regulators, and they tried to gaslight me that I was stupid, that I was asking so many questions, and it was not my place to ask those questions. And in some cases, I maybe accepted, or it wasn't super critical, so I didn't care that much about it. But on the last year, before I left my previous notified body, in the last year, they hired a guy, how should I say? During the last year, when I audited that company, I have seen that they are doing a proper process validation, and was like, wow, that's really cool that you are finally doing it in a way that I would expect process validation to be done. And then one quality engineer just kind of told me in retrospect that, well, we lost our previous guy who was knowledgeable about this. So for like 3, 4, 5 years, we didn't have anybody who could like fully do it or didn't fully understand it. But again, we are talking about a very, very big company. And so they said that, yeah, so we didn't have anybody who was super knowledgeable about that side. And so we just made do with what we can. So in hindsight, it turned out that I was not stupid. They were just trying to gaslight me. So again, it doesn't matter how big or how small the client is, whether it's a startup or someone who's already has 40 years of experience as a manufacturer, you should always be critical about them. And of course, you shouldn't like pound on them. So you shouldn't go on either extreme. Okay, and don't be too lenient and don't be too hung up on nuance or minute topics. This was also part of our presentation once. I'm not going to spend too much time on it. Just make sure that you're not the worst dressed person in the room. And also, but at the same time, it's also kind of a balancing act because you should be ready to also wear PPE if you go into manufacturing. Of course, it might not be relevant if you're auditing a standalone company, a software company, or a virtual manufacturer. But if you need to go into operations, just make sure that your shoes, for example, are suitable to put some covers over this or something like that. Okay, and if you need PPE, I've seen some auditors who actually even had their own PPE, like their own glasses. They had like vision correcting safety glasses or something like that. So if you need those, then it's usually a good idea to bring those with you. Another topic that is also for me the hallmark of a novice auditor is that they are dividing the standard in equal portions based on the number of clauses that they need to audit, and they want to spend equal amount of time to every clause of the standard as they are spending to auditing the different regulatory requirements. For me, this is really not a very good approach. In my book, regulatory requirements always have a bigger impact than quality. And so that's usually also why I have a little bit of misgiving, maybe just a little bit of a side note for SGS, that we are sometimes auditing the regulatory compliance at the very end of the audit, like MDD or MDR compliance at the very end of the audit, because if basic things about the product are not in place, then it doesn't matter if the forklift is properly maintained. If we find out that the device that they are manufacturing is not even a medical device, or the classification has been wrong and for years, or what we have found the other day is that the client is doing sterile products and we only stumble upon it after 4 or 5 years of certification or more, then it doesn't matter too much if the training records are in place for the people, right? So there are certain basic things that should absolutely be, like I show on the right side of this diagram, is that like regulatory compliance, product classification, is it even a medical device? Can it be in the scope of certification? Those are such fundamental questions that should always be clarified first and foremost. And if you need to spend more time to get to the bottom of it, that will have a much bigger impact on the manufacturer's overall compliance than some of the smaller like documentation issues or management representative. Okay, so that is important. On the other hand, if you need to finish your report, you will see that what is on the left side, that there are a lot more quality questions. I would say that if you are an experienced auditor, you will know how to be economic about writing your report and doing your audit, and you will only and if you're lucky, your project will also go to a person who is knowledgeable about that kind of technology or product or process. Okay, and if that match is granted, then you can do, I would say, more optimal auditing. I will give you an example. If you are auditing, I don't know, make it a computer tomography system, right? A CT scanner. For that, biocompatibility is very limited. It has a patient couch. It is not very invasive, but there are many other like high risk elements in that product, right? So in that case, I would just go very, very light-handed on the like biocompatibility aspects, for example, but I would go super deep into radiation protection and electrical safety. Just an example. And then if it goes to tech reviewer who knows these kind of products and knows what's in the scope of the certification, then they will also understand and they will not dig deeper and they will not say, oh, but you didn't check the Revit testing of the patient couch, right? Because that's probably not the most important thing. On the other hand, if you have an implant, like a resorbable implant or something like that, then for sure biocompatibility is the key aspect. You would go super deep into that one, but maybe you would go lighter on some other topics. I don't know, EIFUs or whatever else might not be super relevant or super how should I say, widespread about it, or cybersecurity, for example. So you should really focus on the important aspects, and I think it is absolutely appropriate to, this is what I meant by corner cutting. Maybe that's not the right word, but to optimize your documentation in a way. And I think last month we talked about a little bit about the optimized sampling and note taking of the reviewed records. So I think that is absolutely appropriate so that you can get the optimal output. Couple of maybe remarks about audit planning. So my rule of thumb is that the internal audit duration should be at least twice as long as the external audit duration in a given period, like every year. For example, if our third-party audit is 5 man-days for a client, I would expect them to do at least 10 man-days of internal auditing. It's not a rule. You will not find it anywhere. But in order to do meaningful audit and for giving them the chance to find more stuff than what we would find at an external audit, they need to simply spend more time in their own auditing. Okay, so if I see that we are doing 5 man-days of audit and the client was done with their internal audit in an afternoon, then I'm going to definitely challenge and go deeper if that audit planning was any good, or what was the reason why it was so rushed, what was the reason why the client didn't spend enough resources on that. Okay, because we count on that. Our audits are so heavily sampling based that we cannot we cannot, we really have to rely on the client drawing broader samples on their own, because only the two systems together will provide an optimal outcome. If that's not granted, then we might choose to take over some of the workload, and we will need to say to the client, okay, I'm sorry, your internal audit is garbage and it has been really rushed. Next year, I'm going to recommend an extra 1.5 man-days just to go deeper in some other aspects and take more samples if you don't do it during your internal audit. So we can do it either way, but just also be aware that as auditors, you can have an influence of how the next audit turns out, and you can absolutely make recommendations to the office. Next one, maintain proportions. We talked about not equally spacing the clauses. So that's also an audit planning principle. Don't just spend. This is actually, I also see in the accreditation audits. And maybe you guys, I don't know how many of you have ever participated in an accreditation assessment under any scheme. Maybe let me just go back to the meeting. Could you guys tell me, or by show of hands, how many of you have participated in an accreditation assessment? Can you just raise your hand? 1, 2. Okay, so only two of you. 3.
I did.
Okay, yes. So a couple of you have done it. Maybe I would ask, did you guys, before you went into the first one, did you imagine how the assessors are going to spend their time? For me, and we can discuss about it, for me it was an absolute shock of how little time they are spending with project reviews. Like how little time, like if it's a 3 or 4 day office assessment under ISO 13485 or MDSAP or anything, that basically the process, like the project reviews that they are doing is maybe half a day or 1 day maximum out of it. I don't know if it was the same experience with you guys when you have participated in, but I was always shocked of how little time they were spending over this. Yes, so basically that is kind of also reflective of what we are doing. Maybe it is, of course, because you guys have to do all these things, but if you take a step back and look at your own audit reports from a broader perspective of how little time we are actually spending in manufacturing, and this gets, like I would say, worse and worse year over year, because the time to review all the applicable and new regulatory requirements that keeps us in the boardroom or the meeting room is just growing every year. So proportionally it takes away time from us going down to manufacturing and looking at the production, right? And so it's a little bit the same. It's a little bit the same as for us as it is for the regulators when they are assessing us. Okay, so that's why I'm saying that you should maintain proportions. Okay, because and what I wanted to say with this one is that compared to that, they are splitting the 17 or the reason why they are spending so little time of reviewing our project documentation is because if their assessors are not very good, they're also splitting their respective standards in equal chunks. And in that, service provision is like chapter 9 of the 17021 standard is just one of the chapters, but there's like 10 chapters or I don't know how many chapters are there, but there's a lot of chapters, and they are splitting it equal chunks, and they are spending, for example, I've participated in office assessment where the assessor was spending 2-3 hours checking a liability insurance as a certification body, almost the same amount of time as sampling audit projects to double check. So that's also important to maintain proportions and scale up the audit tasks depending on to fill up the allotted audit time in a meaningful way. Next is consider follow-ups, previous findings and changes. I think is a very dangerous and thing that requires attention. Is someone speaking? Sorry. No. Okay, I thought that someone wants to share something. You guys are welcome to say something, but if it was just for this, then maybe I'm going to lower everyone's hands, or you guys should lower your hands if you don't want to, so that I can see if someone new puts up their hand. Okay, if you guys want to share something. So yeah, consider follow-ups, previous findings, changes. I've seen many cases where project went to certification review or tech review, and the reviewer was like, okay, but there was a finding last year. Did you guys follow up on this? It's like, oh, we forgot it. It wasn't even in the plan. Or if it's multiple auditors, then the auditors are waiting for each other to do the follow-up, because maybe a given type of finding can be followed up under different processes. But when there's too many chefs in the kitchen, eventually nobody did it. So that is clearly a team lead responsibility. So make sure that you don't forget it. Again, follow-ups, previous findings, and any changes that the client had. Okay, that always has to be considered. Another thing that I sometimes see is very fragmented audit trails. So the auditor is almost like having amnesia and being hit by a bus after auditing every process. They're having a mental reset, and they start with the next process with no context or nothing to go on by, and they just again start to draw random samples starting from scratch. That is not optimal. Ideally, you would pick something like one product or one technology or one something, and you want to know everything that goes into that something through all aspects of the quality management system, and then you will get a continuous audit trail. And that is the intention of the regulators, that is the intention of the accreditation bodies, that auditors should have as long and as consecutive audit trails as possible. So what that means is that when I see audit plans, for example, when half of the design and development is assigned to one auditor and the other half to the other auditor, that is not ideal at all. When I see that, half of the CAPA system is reviewed by one auditor and the other half by another auditor, or some other like nonsensical splitting, that is surely already, for me, not an optimally designed audit plan. Okay, so just strive to keep all the topics to the same auditor, all the trainings, one auditor, all the CAPA, all the non-conforming product handling, all the, supplier-related questions and outsourcing should be done by the same auditor, so that they can have the most continuous audit trail possible, okay? Impartiality and versus competence. So that's also a very good question, especially for internal audits. I'm not saying that impartiality is overrated, but definitely there are questions of how much we value and how extreme we take the impartiality of people. For sure, some of the regulators have taken it too far to my liking, to the point where it's not even, I would say, feasible, because they say, and you guys can of course check your own, code of conduct and declaration forms. You will see that, well, if you have ever worked at a manufacturer or their competitor, you cannot audit that client. It's like, why is that? Then how would you say that someone can get relevant industry experience if they cannot audit a client or their competition that they have worked for? If you don't have, maybe if you don't have stocks in a company, then I would say it doesn't matter. If you have, that's probably the only way how you could get relevant experience about a given type of device, is that you have worked at such a manufacturer. Either you worked at the company that you're now auditing, or you worked at their competitor. There are definitely time limits that you shouldn't audit your own work. So that's why we usually have the rule that you shouldn't have done that in the last 3 years. But working at their competitor, if you don't have stocks in either one of the companies, then I don't care if you worked at the competitor. You had to have, your experience somehow. So in my book, competence definitely is more important than impartiality. There's, or impartiality is also important, but we shouldn't take it to such a high degree that it would basically exclude everybody, because beyond a certain point it serves no purpose. Okay, so that's what I just wanted to mention. Also, I want to mention the difference between remote auditing and hybrid auditing versus documentation review. So documentation review is when you are literally by yourself. The client or the auditee in general has sent you a bunch of documents, and then you're by yourself just going through these findings or going through the documents, reviewing them, and then going back to the auditee with the list of your open items or findings. Versus remote and hybrid auditing is an interactive activity. So the auditee and the auditor are typically in one chat room, or in a Teams meeting or a Zoom meeting or something, and the interaction is continuous. Okay, so I just want this to be very clear to everybody that what we are doing is never just documentation review. There are certain types of visits where we do documentation review, like a pre-transfer review, for example, but anything can be upgraded to feel like a remote or a hybrid audit if it is beneficial for the team. So I would always err on the side of picking up the phone and clarifying things with the client ahead of time, rather than wasting all the audit time just so that in the end we'd have still no idea what we were looking at, because some maybe missing parts were missing from the documentation. Especially product assessors are prone to this, that they are spending all the time allocated to them, and only in the end they come back and say, sorry, this is not even a medical device, or it's not even fall under whatever. So I would say that even if you are allocated to do a documentation review, if you have any doubts, pick up the phone and speak with the client. That nothing prevents us from doing that. But the only thing I require two things from when we have calls with clients, is that there should be two people from our side, and the meeting should be either transcribed or recorded, or there should be a scribe from our side who's going to take notes, and they will have no other job just to take notes during the meeting. If that's granted, then I would always say that, yeah, just pick up the phone and clarify with the client. If you are very knowledgeable about that kind of process, you will eventually know what are the most important things, or where the failures typically happen, and you will promote those questions to the beginning of your documentation review. And so you won't even proceed further until you get satisfactory clarification that information is available and it looks legit. If you already see that, like as I mentioned before, the classification is not correct or something like that, you should absolutely start with that and clarify with the client if something is not clear. And if it turns out that the project is a no-go, we should know it sooner rather than later, because that mitigates the losses for both parties. Okay. Next one is about, that's just my private tip based on the auditing that I have done. I like to walk in manufacturing or service provision after lunch. It's a little bit of a pick-me-up. So if you can choose, of course, it's not always possible. It also depends on the shift and whatever you want to see. But with all else things equal, I think it's a great time to go down to manufacturing early afternoon. People are already kind of warmed up. They are not, but that might not be the worst case. So maybe in some other cases, like unannounced audit or something, you want to consider going down to manufacturing early on to have a more accurate picture of what's going on. But I just found that taking a walk in the afternoon, going down to production, is better than just yawning in the meeting room. Plan to request information from other sites or parties on day one. That's again a pro tip. Some auditors interpret the audit plan very literally, but that can get you into trouble. So, for example, if supplier control, right? If you have a bunch of outsourced processes, supplier control might be scheduled on the last day of the audit or the day before the last day. And if the auditee as a legal manufacturer has a manufacturing site in another time zone, Australia, China, wherever the case may be, Europe, and you need to get some batch records or something like that from them, then for me, a pro auditor would look at the audit plan and already have a context that certain processes are outsourced. And on day one, they would start to place those requests. And then maybe they will come back, those requests will come back on day 2 or 3 of the audit, but it's still better than requesting it on day 3 or 4, because then you might have a chance that the record will not even arrive by the time of the closing meeting. So again, if you know that some processes are outsourced, just maybe have a little bit of a look ahead in your audit plan, especially if you're a team member. While you're participating in the opening meeting, you can look at the audit plan and already start to make notes for yourself in your copy and start to place those requests right after the opening meeting so that you will get those records as quick as possible. Of course, it's also possible to request some of these documents ahead of time. So when the audit plan is being sent out, if the audit team lead wants to request some documents so that they are ready by the time of the opening meeting, that is absolutely also possible most of the time. Yeah, and that leads me to the last one. It's request lists in advance, all of them. So we have an email template for sending out audit plans, but it's the same for every auditor everywhere. That if you want to do some sampling, then it's really a good advice to get the lists of sampled items to be available so that you don't have to start and get the auditee generated after the opening meeting, but you already have those lists and you can place those requests, and that will save time for everybody. So there's a little bit of a gap right after the opening meeting that the unprepared auditor will start to place requests, and then they are just fiddling their thumb for an hour or two after the opening meeting, or the pro ones already came with their plans and they're already starting to pull records, and then you have a jump start for the whole audit, and you're wasting less time. The next one is audit execution and meetings, right? So opening and closing meetings don't have to happen immediately adjacent to the audit sessions. It might sound a little bit unorthodox, but that is the truth. Nothing in the standard says that the opening or closing meeting has to happen immediately before or after the audit. In fact, if you have participated in some of the office assessments, you will know that most of the time the office assessors are doing their closing meeting a couple of days later when they have finalized their notes and findings and they spoke with each other, and then they will come back and say, okay, if the office assessment ended on a Friday, they might propose a closing meeting on Monday or Tuesday the next week. So I'm not saying that we should always do that, because of course we are doing back-to-back audits, especially the full-time auditors. But if you have a situation where the sterilization review is done 2 weeks after the main body of the audit, or something like that, or there's another site that is still under auditing and will finish only the next week, then please consider this, that the closing meeting might be not adjacent to the team lead's last day of auditing. Okay, let me put it that way. So it may happen that you will, because every team lead is typically also a team member, and when you as a team member have done your auditing, it doesn't mean that there has to be a closing meeting right then just because you are there as the team lead. It may happen that you will need to wait until all of your team members do all parts of the auditing, and only after that you will do the full closing meeting so that you can give a full result for the client. Before that, theoretically, you can only give them a preliminary result, because each audit only has one opening and one closing meeting officially. You can have other types of meetings in between, but the opening and closing meeting has to encompass all the auditing activity if you want to call it one audit. Another solution is to split it out and say that these are different audits. Yeah, the people who are organizing the audits are going to typically start that discussion, and as an auditor you can always push back and say that no, maybe it makes sense to split that activity out to a separate audit. So if that's the case, then just let the schedulers know. If there is a checklist, use it every time. There is no downside to using a checklist. I've been an auditor for many years. Even today, when I would do an audit, I would absolutely insist on using the checklist all the time. It just simply helps you not to forget any items. Anything can come up, in an audit. Maybe you think that you already got it memorized by heart, but it can, things can change. Sometimes the checklist contents are changing, or a given message about a given line item is changing. And even if everything is the same, the client may show up with a couple of new managers in the opening meeting. So I know that the standard allows us to do an abbreviated opening and closing meeting, depending on the circumstances, the type of the audit, and everything else. But I would still consider going through the checklist. Just keep the items that are not relevant for the given audit, but definitely don't end up in a situation that you're forgetting it. I have also seen witness audits where at least 2 or 3 audits, the AO or the CB got non-conformity because the lead auditor didn't use the opening or closing meeting checklist, and they missed some of the items that they should have talked about. And it is absolutely avoidable. Like that, we should never get a non-conformity because of that. Another rookie mistake, and if you look at the opening and closing meeting checklist, even for SGS, it only requires the audit team to introduce themselves, but it doesn't include the item of letting the client introduce themselves. And I know that some of the maybe rookie team leads or lead auditor in training or acting leads, for example, they are so nervous about not messing anything up about the opening meeting that they just strictly go down like a robot. They don't even look up from the paper. They're just reading the opening meeting items. And the client may consider that to be quite rude if only the audit team introduces themselves, but we don't give a chance for the client to introduce themselves as well. It may very well come across as we are not even interested in them as human beings, and that's definitely not a good start for the audit. So please make sure that when you are introducing yourself, immediately offer the client that they should introduce themselves, or you can also do it in a way that they introduce themselves first and then you go second. Doesn't matter, but make sure that all parties introduce themselves. Okay, it's just basic courtesy. And then consider the human element. Sometimes, audits are very stressful to people, and they are very uptight about it, and they are not very relaxed. You can definitely show your approachability and human side if you explicitly address some of the human needs, like taking bio breaks or something like that, because the client is often, they don't want to disrespect you for asking for a toilet break, but they, are really uncomfortable answering questions if their bladder is full. Okay, so just be more preemptive and be more proactive about it. If someone needs to take a bio break or something is needed, then that should always be possible. Okay, or if they have a very urgent phone call to take or something like that, that's not going to be the end of the world. I think that can put everyone at ease more, that it kind of puts you guys on their side, and they know that you are there for them and not against them. Okay, so every little bit counts, I think. Also, one of the things that some of the novice auditors are really flabbergasted about, especially when they go to their first couple of training audits, they see that it's an absolute chaos and it's an endless vast universe of knowledge that they have to know. But over time, if auditors participate in audits, then they understand that it's closer to a 20 questions situation, where module by module or subsystem by subsystem, basically every QMS comes down to a finite permutation. And even these permutations are not completely random. Usually they are proportionate to either the maturity or the organization size. And by and large, you will find similar solutions or similar level of maturity or complexity of solutions across the different QMSs. So I just highlighted in this picture a couple of maybe things. That, for example, doc control can be like the most sophisticated would be an current EQMS system, but an old company or a small company who do very little medical business might just be have a paper-based documentation. If you look at their ERP systems of how they are keeping track of manufacturing records and batch records and manufacturing lots and everything, of course, maybe you would have an ERP system. A client who's less sophisticated or has less amount of business, maybe they just track things in Microsoft Access that they have developed in-house, or someone who's like really very beginner, like maybe a startup, they would just simply have an Excel spreadsheet. But you would very rarely find a Boston Scientific to run things on Excel, right? So you will recognize these kind of patterns as you will audit a couple of manufacturers. There's not an infinite, maybe like hypothetically, there can be infinite combinations, but in reality, you will narrow down that, when you need to audit dock control, you only need to consider a couple of basic scenarios. It's not like an endless combination. And this experience comes from just auditing and just seeing more and more different kinds of QMSs, so that these patterns will crystallize in your mind. And then you will feel much more confident that if you go into a process, you will know that it's not an endless variation of things. You can kind of predict the 2-3 things that the client potentially will utilize, and if they do something completely different, then that can already raise a couple of red flags that you need to dig deeper to see, okay, then it's not the typical fare. How are they still compliant? So, but that can definitely shape your audit. So certain things, if it makes sense, then you just easily go through and just state the compliance. But something is like really wonky. Like I had one client back in the days where they said that non-conformity can happen as a result of any process. So they didn't have a collected non-conformity process. They just had a non-conformity clause at the end of each of their other processes. So they could have one at, incoming inspection, final inspection, internal audit, whatever the process may be, risk management, everything, every form they had ended with a non-conformity slip. So as they are executing the process, they could record non-conformities then and there. So it was kind of, okay, it makes sense, but at the same time, that way they didn't have a collected list of non-conformities because they kept track of it process by process. So it was, again, a different approach, really peculiar. Ever since then, I haven't seen it. It kind of made sense for them. It seemed like they had a good control, but I had to spend more time in checking non-conforming products or non-conformities overall, because they had a disjointed system. Okay, so these are the kind of things that you will be easily able to recognize, and you can spend more time with it, and that will then you can. But then you will need to find time. What is it that you can give up, or where you can go a little bit leaner? For the interviews, of course, you can have different directions, and they're suitable for different purposes. So, you can go forward when client gives you, or the auditee gives you, a general description of the process, and you kind of go top down. You look at the procedure, look at the related work instructions, and then you do records. But in some other cases, you start with the product, you work your way backwards, like an unannounced audit, for example. Then you would look at the DHR of that unit, you would look at the DMR and back all the way to the DHF to see if they have any problems, then where did it originate from? Okay, so it can really go either way. It also depends on the type of the investigation or assessment. Like if the client gets a complaint about the product, of course, they will need to go backwards. But in general, for our third-party audits, most of the time we go forward, unless we have a specific question. Or if you, as an auditor, already found a non-conformity, then you can follow up backwards of where that non-conformity originated. Okay, so these are maybe some of the strategies. Also, be very careful about cutting the auditee short. So you can see these arrows in the chain of the interviews. And of course, in some cases, as an experienced auditor, you may already think that you know what the client is going to say next. And in order to save some time in the audit, you want to cut them short and say, okay, now I know. And then you will, want to bypass a couple of steps and get to the answer that you really want. I have also found that this is kind of hit and miss, and you really have to be careful, because you can very easily spend more time than what you wanted to save by missing out on critical information. Maybe somewhere along the line between like one of these in-between steps, like the procedure or work instruction, you would have learned that whoever you're out interviewing is not even responsible for that process, or they regulate it in a completely different way, and then based on your assumption, you go down in a dead end, and it's very hard to come back. Okay, and then you're just wasting more time. If there are potential findings, keep the auditee informed immediately. No sugarcoating or hidden surprises. I think it goes without saying, but I think it's super important to clarify that there are no exceptions to this. Okay, so this is such a basic auditing human aspect that we owe it to every paying client, but also we do the same for internal audits. So if there's any surprises, we will immediately let them know that this might or will result in a non-conformity. My trick is typically to tell the client that, okay, I'm just telling you that if you cannot, like this looks like a non-conformity, if you have more evidence, you are welcome to give it to me up until before the closing meeting. If you cannot come back to me with other evidence by the time of the closing meeting, then I will raise this as a minor or major non-conformity or whatever MDSAP grade it is. So that way the client feels that they have a little bit of chance, that you're not just cornering them on day one and you are set in your mind. You give them a chance. If they don't come back, maybe they will internally review it for a couple of days and try to find some other evidence, but that also gets them time to mentally adjust to the reality that they don't have anything and they will get a non-conformity because you have told them in advance, and it's on them. It's not because you suddenly cornered them at the closing meeting that, oh, by the way, guys, you got a major. They should know it from day one that if they don't give you something better, then it will be a major, and because of this and this and this. Okay, and that way also, if they want to argue about why it's a finding, you have a couple of days to hash it out. So by the time of the closing meeting, there really should be no surprises unless you find something on the last day, which is also the reason why it's not a very good idea to close the audit with all the MDR and MDD topics, because there can be a bunch of non-conformities there as well. Always express your appreciation to anyone helping your audit. Let the auditees take pride in explaining you their work and say please and thank you. Okay, so it is really important that they are doing a favor, that it doesn't matter how little you want to interrupt them, you are still interrupting their work, and so you should really appreciate them helping you. It doesn't matter whether it's a first, second, or third party audit. You should always thank the auditee. Sometimes they go into a little bit extra details that might not be value added for you in your audit, the level of detail that they explain certain processes to you, but as much as you have time or can make time, not everyone's a big talker. Maybe also you can recognize that, different people at the client are more on the extrovert, introvert spectrum, but if they want to talk more, then let them talk a little bit more. You will have a lot of goodwill, and they will like you more, and they will help you more if you let them speak a little bit. Okay, so don't cut them short. Don't make the audit about you only. It's like a group effort to find compliance and non-compliance with the client. Audit trail and sampling, we already talked about this. So generally try to squeeze the most information from the fewest documents to form the longest consecutive audit trail. That's my principle about sampling. So for example, instead of, because I've seen this also in our shared folders, that the client has already submitted the management review for the third time, and they always put it in a different folder because different auditor asked for it or something like that. And then you maybe don't even know if these are, like, if you have requested multiple management review records and which one is the latest. So instead of that, try to reuse the information to all the processes that you can. So in the management review report, for example, you can find information about non-conforming products, complaints, internal audit, suppliers, risk management. Don't re-request it. Try to not only just have it once, but also make notes in the respective other tasks, and that's why it's so important that if you are doing this, then you should also do these as much as possible. Or if you are not doing some of these, then there should be an exchange of the audit trail information between you and the other auditor, that you will tell them that, oh, in the management review, I've seen that this was the problematic supplier. I'm not going to audit supplier control this year, so can you please check on this and this supplier? Maybe you want to take some others as well, but these two are problematic. So that's how we get the most consecutive trails and reusing the fewest documents, because every time we get a new document, we have to review it and request it and review and check doc controls and everything else. So we are just wasting time. Of course, in some cases, it might be beneficial if you have some evidence that they are struggling with doc control, then you might want to increase your sample, but try to be as efficient as possible so that you can spend time more meaningfully, not just always writing down new record identifiers and document identifiers. Try to get the most mileage out of the fewest possible auditing asset by default, unless you need to go broader because the whole system is shaky. Use judgment-based sampling wherever possible over random sampling. So, if you get a list of CAPAs or you get a list of complaints or whatever else, then try to run some keyword searches, of what's going on. Try to capture some trends and then follow up on those rather than just, give me 50 records. And then you're going to spend half a day just looking the same 50 records because none of them give you any useful information. Okay, so judgment-based sampling is in every scheme more valuable and more efficient than random sampling. Okay. Note taking. So only use a tablet or auditing software or other gadget if it helps you being more productive. For example, if you cannot bring in paper in a clean room, then you might bring in a tablet that can be properly sanitized, and that might be beneficial. But always try the tools first. Don't stumble, in front of the client. So yeah, if having a sophisticated and nice toy is not making you more productive, then don't just show off. It's not going to generate anything good during the audit. So only use tools that are value added and make you more productive and make you more consistent or takes off workload from you so that you can focus more on the auditing. Okay. Use templates and boilerplates, but make sure that you customize them. So I think an efficient auditing always requires that you have some pre-formulated texts that are somehow like modularly built in a language that sounds human when you finally customize it. But please make sure that you do customize it. If you leave meaningless boilerplates in your reports, doesn't matter what scheme, what context you're auditing, it will always be challenged. Okay, so that, and be very careful with checklists because they promote poor auditing. As I mentioned before, in a checklist, if you have, for example, the ISO 13485 split too evenly between the different clauses, then basically a checklist will look complete even if you just take one sample for each clause, and it will kind of promote that you spend equal amount of time because you have to fill in the checklist. Okay, so make sure that the checklist serves you and not the other way around. Ultimately, the auditors are always, regardless of the context, auditors are paid or tasked to use their brain and use their judgment to make a good quality auditing, and that is usually incompatible with the requirement to spend equal amount of time for every clause of the standard. I think we already talked about it very clearly. Also, when you are taking notes during the audit, be aware that your notes that you are taking is serving two purposes. One is that they are some auditing artifacts. They show notes to follow up and cross-check, or to keep track of open items in an easier findable way. That is also important. You need to have some notes, what was the kappa number of the kappa that I wanted to go deeper. Maybe I found it in the internal audit and I want to go deeper later during the day. So for sure, taking those type of notes is appropriate and necessary. But make sure that whatever is not needed in the final report, that you remove those. So there can be like your thoughts of, internal notes. Okay, Balazs, make sure to follow up on this or something like that. Please don't leave those sentences in the final report. Sometimes we see like incomplete sentences or just like incoherent thoughts that made sense maybe at the time of the audit, or you're just quickly jotting down some keywords from an interview that you hear from someone, and later you wanted to clean it up, but then you forgot, and then those incoherent words are left in your final report, and whoever is reviewing it, the regulator or a tech reviewer, will not know how to handle those texts. Okay, so make sure that that those auditing artifacts are cleaned up. What you can also do is apply, like whatever note-taking tool you use, if it allows, like for example Word, you can define custom styles, and you can, for example, have a temporary note style defined in Word, and then later you can in Word if you click on the right click the style, it can find all occurrences of that text, and then you can just delete it in the end, or at least it will highlight for you, and then you can change it or clean it up. So for sure these auditing artifacts need to be resolved somehow. And then you have the final content for reporting, in which what I found the most important thing that's usually missing is your evaluation. As I mentioned a couple of slides back, if you're just a scribe and saying, yeah, this is what the client said, that is not auditing. The auditing comes from you providing your evaluation of what you have seen is compliant with the audit criteria. And if it's not, then you have to state it. If it's compliant, you also have to state it so that your work is reproducible. That's the key aspect there. Whatever you're doing, whenever someone is checking on your work, they should be able to see and walk down the same path as you did, and should generally come to the same conclusion. Okay, but if you just say that this is what the client said, but you don't say that it was compliant, then they will not know if you added any value of that, or you even have the knowledge to judge that. Okay. Obviously, some other things, don't just jot down the SOP as an evidence and be done with the clause. Overall, there's multiple types of evidence. Typically, there's 4 big groups. Maybe there's others, but I consider these 4 to be the main ones. Driving documents like procedures and work instructions. You can have records, you can have interview results, and you can observe processes and take your own notes for those. Okay, we already talked about depth and breadth. On the budget, use the 80-20 rule. Also, I would say you should write more details, what you saw in a document or what was discussed in an interview when there are findings. Otherwise, just have enough details for the audit to be reproducible. As I already mentioned, it is acceptable to just keep a copy of the reviewed document until the audit is concluded. So don't immediately give back documents, don't immediately, or ask them to make a copy of for you, or scan it, or make a photocopy, or don't just show it on the screen if it's a digital document, but make a screenshot or send me the attachment via email or a shared folder. So you should hold on to those documents, okay? Because it's also easier to answer post-audit questions and avoid tampering with the objective evidence. I have had cases in the past where I wrote non-conformities and the client said that no, that was never a non-conformity. We had it in the procedure, and then they showed the version. Maybe they came back to the closing meeting with the version. It was the same document number, same revision as what I had in my notes, but they proved that whatever I was asking for is really there. And I was like, that doesn't sound familiar, like this whole section. And then I had that document in my own repository, and I pulled up, and it was the same document number and revision, but they changed the content during the audit to basically fake themselves out of a non-conformity. And I said, okay, I code them with that, so they got an extra non-conformity for doc control as well. So yeah, just be mindful that keeping your own stash or repository, as much as it is consistent with the confidentiality requirements to the audit, you should keep and hoard as many documents as possible. I think it will serve you well going down the road. Okay, findings. The most important thing about finding is write the necessary findings. Don't write too little findings. Don't write too much. Write the necessary findings and only those. Okay, so that's I would say the most important concept. Keep the findings objective. There should be no opinion, no speculation, no exaggeration, no brainstorming, no premature problem solving bundled into the problem statement. And also keep the findings reproducible based on the objective evidence. So if someone will come back next year, different auditor, different client representative, they should be able to verify and reproduce this non-conformity. As much as possible, try to use the verbiage and precise reference of the requirement source when wording the problem statement. So if it's a standard clause, if it's a regulation, if it's the manufacturer's own QMS procedure that was the basis of the non-conformity, not only write down the document number and the chapter or whatever internal pointer you have, but also try to word your finding in a way that is based on the wording of the original requirement. So if the standard says that the manufacturer, should document the result of this in a documented procedure, then, write it exactly with those words. Just put it in the beginning that I have, I found no evidence the client is doing this and this and this. And then it will be very clear of which section of the standard you're talking about. And even if they do a text search and they later want to challenge you, why is this non-conformity? It will be very easy to find that reference. Okay, so don't skimp on this. Don't introduce new terms or come up with new verbiage or try to open new can of worms. If there is non-conformity against an audit criteria, just state it very plainly and in a traceable fashion. Okay. The contrast between the observed fact versus the specified requirement should speak for itself. The context field, I know that many non-conformity reports require a context of the audit where you explain the impact and everything else. For me, that's a little bit superfluous. I would say most of the time it shouldn't even be necessary. I know that it is necessary, but I'm just saying that if you have to explain there, and I've seen some auditors also put some extra objective evidence in the context field, which is absolutely incorrect. So the context field should just maybe give a little bit of your opinion of why you think that this is a big deal and why it should be established as a non-conformity, why it adds value to the discussion. So just be honest in that field. Don't introduce anything new. Just express why to you it sounds that it will cause problems in the future. Okay, but by itself, the observed fact and the specified requirement, those two fields should explain the non-conformity by itself. So you shouldn't spend more words in further explaining that this is non-conformity. It should be clear for a qualified person. Okay. Post-audit activities reporting. One of the US FDA assessors once told me, he was a French guy, so he quoted it from Voltaire, that perfect is the enemy of good. It also applies for, like I mentioned in the beginning, that you don't have to over-polish your projects. Just make good quality content and make it available on time. A good enough audit report on time is 100 times more valuable than a perfect audit report that is 3 months late. And I can universally say that everybody thinks about it. The client, the regulators, the notified body, everybody thinks that the report on time is the most important thing because that keeps the whole quality program in motion. Okay, and usually there's always next time. Maybe different organizations are better at recognizing it, that there's always next time, but for sure we don't have to be afraid of making small mistakes or small omissions. Of course, you could always take different or more samples, but this is what we had time for. If what you have done has a good justification and you can paint a picture that I went down this path and I spent extra time with this at the expense of that other process, because in my professional opinion, this was more critical and the client was also struggling more in that topic, everyone is going to accept that. Nobody's going to say that, oh, but you have, didn't take, 5 forklift certificates, just 3. Nobody's going to say that if you said that they had a death or they had a vigilance case in the surveillance period. So just make sure that you put some context of why you have gone down a given path and why that causes deviation from the plan. If it's a big deviation, why maybe if there were obstacles or something, why that introduces uncertainty in the audit result. So just be honest about it and give your best approach to justify. I think one of my ex-colleagues who was once the certification manager at that company where I worked, he used to say that there are 3 rules of a good audit report. If you wanted to go through reviews and certification review quickly, is justification, justification, and justification. So you should always paint a picture of what you did, why you went down that ladder, why you sampled these extra records, why you did that at the expense of something else. Of course, the opportunity cost at an audit is very real. If you're doing A, then you will not do B. And so you have to justify why you rather did A and B, especially if it's deviating from the plan. For the non-conformity evaluation overall, you should check the CAPA form overall. If the client sends you a CAPA form as a response with their findings, you should check whether even their methodology is sound. Does the CAPA form follow the definitions of correction, corrective action, and preventive action? Are there fields for this information? Sometimes the manufacturer in their form already has just one field that combines correction and corrective action, and you cannot even tell apart which one is which. Does the submitted CAPA form follow the typical 5D or 8D problem-solving process? Like as a minimum, you would have a problem description, correction, root cause analysis, and corrective action. Is there unique ID for each CAPA? Sometimes the client is like using some creative liberties of recomposing your CAPAs or merging your non-conformities into one CAPA, or they will just open one CAPA for all the findings that they receive in an audit. And then the problem is that sometimes they just skip parts of the non-conformity, and then of course they cannot even give a full answer if they already threw out 3 of your findings. They didn't establish them in the CAPA process, or if your findings had multiple parts but they only copied the first part in their CAPA record and not the second part, then they will already have an incomplete record, and so you can already foresee that they are going to come back with very limited information, and maybe they think that it was complete, but they didn't. That's all part of the non-conformity. And have all required attachments. If you required attachments, for example, for a major non-conformity, you required maybe CAPA plans for a minor or the implementation evidence for major. Have it been submitted and in accordance with the ones required in the non-conformity report? So, if you requested evidence, then you will not accept just the plan. Of course, if you only requested plan, but they already did the implementation, you can review it. Probably that adds value, but you should follow the program rules always. And you can have also other common results for all non-conformities. So, for example, if you find that, I don't know, there's no clear description of timelines for the actions or who's going to be responsible or that kind of thing, if you find something like that, then you can push back on that one. And of course, you have to keep track of the status of individual findings. You may get partial response. So, this is kind of a checklist that I use. You are also welcome to use it. It's going to be part of the recording of this call. And that's pretty much it. Did you guys have any other good tricks or maybe pro tip for future auditors or an auditor, like an internal auditor or a supplier auditor who is very new to this, and maybe to avoid the mistakes that we have made back when we were, I don't know, young or beginners?